Hello everyone, this is about Krok 1 February 2021. It wasn't a easy booklet. It had a lot of challenging questions and a lot of doubts for students who did it. So I will go through the doubtful questions that were in the exam. One of them was the questions about extrasystole. 3 questions were about extrasystole. So let's speak about extrasystole in details and what they asked about in these 3 questions exactly. So let's see this question. Only one of these statements about the extraordinary excitation occurring in the ventricular myocardium is correct. Name the correct statement. So extraordinary contractions means that in case of ventricle, the ventricles are not following the orders from the SA node. Not following the orders from the SA node. The ventricles are contracting from themselves. Okay, so this is called ventricular extrasystole, extra contraction of the ventricles. So what is the problem? The problem is that when the ventricle will contract, it will not receive any impulses from the sinoatrial node, or it will not respond to impulses coming from the sinoatrial node. That's why after ventricular extrasystole, there will be relaxation of this ventricle. So the ventricle will contract and then it will relax. But in the relaxation phase of this ventricle, this is the time where the sinoatrial node wants to give its impulses to the ventricles at the same time. So when the ventricles are relaxing, the SA node tries to stimulate the ventricles. So the ventricles will not respond to that stimulus because it's in the phase of relaxation. And this creates for us the compensatory pause. In that the P in the ECG happens, but the QRST is like there is a long pause till the QRST happens because the ventricles cannot react rapidly like in normal situation because it's in the phase of relaxation. So that's 2 questions about the thing. Now here what they are asking about the statement, which statement is correct about the ventricular myocardium. Here the right answer in my opinion is that it has no effect on the automaticity of the sinoatrial node. It means that the ventricular extrasystole does not affect the automaticity of the sinoatrial node. Automaticity of the sinoatrial node is the ability of sinoatrial node to generate impulses without any interference. It generates impulses from itself. So the ventricles here, when they contract extrasystole, they don't affect the automaticity because they have no ability to travel backwards to affect sinoatrial node. So they don't pass from the between the atrial ventricles and the AV node. They don't pass backwards. That's why they don't have any ability to affect the automaticity, and this is a correct statement. Also, this full PDF you can find in the Telegram channel, Krok1, you can find it in the description. Okay, so that was the first question about extrasystole. The second one was number 15 here. A patient diagnosed with myocarditis has irregular pulse. He has extrasystoles. What causes a compensatory pause in this cause? So what causes is myocardial refractoriness or ventricular myocardium having relaxation before receiving the next impulse, before it can receive the next impulse. And here it is from this is a paragraph of the Pathophysiology book I recommended to study about that. They bring concepts from it in the exam often. Okay, and also the third question about extrasystole in the same exam, 3 questions. Imagine extrasystole caused by excitation when the ventricles lead to, so again it leads to the compensatory pause of the atria. So that was about extrasystole. questions. Now, also, let's speak about questions. For example, here, the fetus have an epidural hematoma, so it's collection of blood above the dura mater. It's probably due to injury during the birth, during like birth canal, passing of the fetus birth canal, and antenatal period is a period during birth. Here we have a question that patient with influenza has fever, dyspnea, tachycardia. How will oxygen affinity of hemoglobin change? Oxygen affinity for hemoglobin means how strongly oxygen will bind to hemoglobin. So if it binds strongly, then we have a curve that describes it. If it binds strongly, then the curve will shift to the left, goes to the left. It's like the right curve, the green curve. If it binds weakly, then it goes to the right, goes to right. That the oxygen is not binding with the hemoglobin strongly. So here in fever, we have factors that can affect that. For example, if oxygen increases, then binding will be stronger. If oxygen decreases, binding will be weaker, and so on. One of the criteria for shifting of the curve is temperature. If temperature increases, then the curve will be shifted to the right. Oxygen will be bind weakly to the hemoglobin, and increased temperature here can be translated as fever. So temperature shift to the curve of the right, it means decrease affinity, decrease of the affinity. Here we have questions about pathomorphology, someone with chronic renal failure. The chronic renal failure leads to increase of the urea in the blood, we call it uremia, and uremia can trigger fibrinous inflammation, as you can see in the question, a thin filamentous coating in the area around the pericardium, around the pleural cavity, so the type of inflammation is fibrinous inflammation. Also, like similar question about someone with renal failure after inflammation of the glomerulus, and then what is the finding, what is the proof that there is a renal failure? It is uremia or increase of urea in the blood, because urea is a substance waste by the body that is filtered by the kidney. When the kidney is failed, it will increase in the blood, okay? And urea, it composed out of nitrogen, so it means that increased urea, increased nitrogen, and we call increased nitrogen hyperazotemia. Okay. Here there's a question about the valves of the heart, what connective tissue they have. So the connective tissue of the valves will be dense connective tissue because of the nature of their function, that they have to do like a powerful, tolerate a lot of tension from the blood, and also endothelium continuous with the blood vessels. So the heart, okay, valves, the heart valves and the endothelium are continuous. That's why like the endothelium forms a part of the valve in addition to the connective tissue. Okay, and also here we have a man taking a large doses of sulfonamides, antibiotics, and then he has methemoglobin. So methemoglobin is like the it's like combination of nitrates with hemoglobin. We call it methemoglobin. And sulfonamides, we have some of these substances, sulfonamides. So what is the danger of this? The danger of this is that in our hemoglobin there is iron as in the +2 state, and this is the state that can carry oxygen. So in methemoglobin, when it binds to the hemoglobin, it oxidizes iron to the Fe+3 state, and this state of iron cannot bind oxygen, so that will cause hemic hypoxia, or inability to deliver oxygen to the tissues because of the hemoglobin cause. And this is the mechanism of hemoglobin inactivation and oxidation of iron in hemoglobin. Here a question about biochemistry. It's like not an easy one. Someone with hereditary hyperammonemia, okay, so he has a lot of ammonia in the blood, and he has disturbed ornithine cycle, and then he had orotic aciduria, orotic acid in the urine. So what metabolite of ornithine cycle has high levels in this case? So here, first of all, what is ornithine cycle? It's the cycle when we take nitrogen and we make out of it urea. So this is called the ornithine cycle, very important. And one of its metabolites is carbamyl phosphate, one of the participants in this cycle. Also, carbamyl phosphate participates in another pathway in biochemistry called pyrimidine synthesis, where it can convert glutamine into carbamyl phosphate and then makes orotic acid. So in case this cycle is not working, ornithine cycle, carbamyl phosphate will increase, okay, because it's not being used. Then it will be shifted to another pathway called pyrimidine synthesis, and carbamyl phosphate will increase here and produce orotic acid in this pathway. So that's why orotic acid will appear in the urine, and the metabolite of ornithine cycle is increased, in this case called carbamyl phosphate. So it needs a little bit some understanding of biochemistry pathways. Also here we have a question about parathyroid decreased, so it can be understandable if parathyroid original function is increased calcium in the blood, and it increases calcium in the blood by reabsorbing it from the kidney to the blood. So when the calcium is going out in the urine, it reabsorbs it back to the blood, it saves it. So if we have insufficiency, decrease of parathyroid hormone, then it decreases calcium in the blood because there is decreased absorption from the kidney to the blood. Also here we have a question about diagnosis of hepatitis and myocardial infarction shows activity of alanine aspartate aminotransferase increase in blood plasma. So these are because of what? Hepatitis, damage to the liver cells. So the liver cells will open and release their enzymes. Also myocardial infarction, death of an area of the heart, heart cells will open, release their enzymes into the blood. So this is the marker of the pathology in the organ, marker, or there is something wrong with the organ. We see them increase in the blood. And why they increase in the blood? Because of the damage to the cell membranes and release of enzymes into the blood. Okay, this question also a little bit doubts in it. Someone who has with signs of bilateral spontaneous pneumothorax. So spontaneous pneumothorax is a pneumothorax without any trauma. So first of all, this is the lungs, this is the pleural cavity around the lungs. The pneumothorax is presence of air inside the pleural cavity. There should not be air inside pleural cavity. Air is only in the lungs. In case there is air inside the pleural cavity, we call it pneumothorax. Spontaneous pneumothorax is air inside the pleural cavity, not because of any trauma from outside. No, the chest cavity is intact. There is no damage to it. But there is a rupture of a part of the lung, okay, and air will go from there. And this is probably because of some disease like emphysema in this case. So here we see that in the lung, under the pleura, there are blisters filled with air, so like bubbles under the pleura, and the lungs exhibit increased airness or a lot of air inside the lungs. So here in this case, it is interstitial pulmonary emphysema. Emphysema is a disease that causes thinning of the alveolar septum. So between here, the alveoli, we have borders, okay? Emphysema will cause these borders to disappear. So we will have one big large alveoli that unable to do any exchange of the air. And interstitial pulmonary emphysema, it means that emphysema around the alveoli, in the interstitial space around it, and this has more risk to rupture, okay, and cause air to go to the alveolar cavity outside. This has more risk. Diffuse obstructive, it's more in the bronchi. There is more emphysema in the bronchi, distal bronchi, and the alveoli, rather than interstitial, which is closer to the chest cavity. Here we have a question about someone has lymphocytopenia, decreased lymphocytes in the blood, okay, but B lymphocytes are normal. So it decreased lymphocytes, but not because of B lymphocytes. B lymphocytes are normal. So what is left? The left is T lymphocytes, so they are decreased. If this is like normal, then the problem is T lymphocytes, and the most asked T lymphocyte deficiency. Krok one is DiGeorge syndrome, and yes, we can see here, we can see other signs of DiGeorge syndrome like convulsions, because of the absence of parathyroid gland, which is in the DiGeorge syndrome. Decreased calcium will lead to convulsions. Also, we can see fungal infections. T cells are responsible for fungal immunity, immunity against fungi. So it's signs of decrease of T cells, so it's DiGeorge syndrome. Here a question about, we can see in histology, cells of the tissue form isogenic groups. So this is like a specific feature of the cartilage, specifically hyaline cartilage, is that it can be found in groups, okay, and it is found here. This question appeared in dentistry before, and it's for the first time appears in medicine. And this is like how I said about this in my Instagram post, that new questions in medicine can come based on previous dentistry booklets. Pay attention to that if you want to be exposed to more questions, practice more questions, solve the dentistry booklets, and this is what we already do in our course. We make the students practice all of the questions in one place. Here, a person with botulism. Botulism is a bacterial infection, okay, because of eating old canned food, okay. And it's an anaerobic bacteria, so it lives without oxygen. So the cultivation conditions, in a case I want to diagnose it, I want to make it cultivated, culture it, I need a condition of no oxygen to it, Kitta rosy medium. Here we have someone with hepatic pathology, has bradycardia, low blood pressure, signs of nervous system depression. What hepatic pathology can be characterized by these signs? So hepatic pathology means that one of these can be all, like they are hepatic pathologies, but bradycardia, this is cholemic syndrome. It increases bile in the blood, okay? So the liver is not working. It's not excreting bile, okay? It's not excreting bile, so bile will increase and it will go to the blood, and bile damages the sinoatrial node in the heart, leading to decreased heart rate. So this is like a very specific thing they ask about often also. Okay. This question about oxygen supply of a nerve cell, mammalian nerve cell, was completely stopped. How will the resting potential change in this case? So this question, two ideas about it in this booklet as well. So if the oxygen supply will stop, what will happen to resting membrane potential? What is the link between resting membrane potential and the oxygen supply? So it links to the glycolysis or the energy supply of the cell. So here we have the cell, we have the mitochondria, okay. Here we have, for example, glucose. Glucose comes to the cell, okay, and if there is oxygen, glucose will enter the mitochondria to produce for me ATP in case of oxygen. So in case of oxygen, ATP, what do I use it for? I will use ATP as energy power, okay, like electricity, to power or switch on my sodium potassium ATPase channel. And what is the role of this channel? The role of this channel is to take potassium inside while taking sodium outside. Okay, this is the rule of this channel, and this rule is very important to maintain positive charge outside and negative charge inside, because if sodium stays inside, the negative charge inside will not be developed. Okay, so this is very important for this charge. This difference of charge, we call it resting membrane potential. Okay, now where they will ask you the question, they will ask you, oh, we don't have oxygen, we don't have ATP, and this was in previous booklets. In previous booklet question, we don't have ATP. What will happen to resting membrane potential? It will disappear. Now they ask the same question but another way. We don't have oxygen, so we will not have this resting membrane potential will disappear. And this question in like we don't have ATP, we explained it in our Telegram channel in the 6th of September, like about 3 months before the exam, because I know that how important is this concept, and there is a separate video for it in our Telegram channel if you'd like to check it out. So that's how they like also an idea about how they change the questions and how how do you need to understand the concepts. So let me show you the same question, different idea also. During generation of action potential in one nerve fiber, ATP energy is used for what? So here they're asking about energy. ATP is used for what? What is the role of ATP? So here the right answer is restoration of ion asymmetry, restoration of the ionic change, ionic asymmetry, ionic difference, ionic imbalance. It's important that I have more positive charge outside and more negative charge inside. So I will have this minus 70 resting membrane potential. So the action potential can happen. This is the next concept, how action potential will happen. The sodium will enter and so on. So restoration of ionic asymmetry. So you see how the concepts here, if you understand it in one video like here, you will be able to solve the question easily. Okay. Also, what other ideas I would like to discuss with you? For example, anatomy questions. For you wondering how the anatomy questions come, sometimes they bring like little, not an easy questions about anatomy, where the portal hepatic vein begins. So where exactly in anatomy? So it's like not an easy question. It begins between the splenic vein and superior mesenteric vein joining with each other. And this joining happens here, and it's behind the body of the pancreas, Okay. This question, a person can raise an arm to a given height relative to the torso with the eyes closed. So what is this question? So it means that even that when his eyes are closed, he can raise his arm to his torso, or he can raise his arm to a specific place in his body. So this ability, it may seem for you like natural, but it needs some receptors, it needs some coordination. And we need to get a sense of where our joints and muscles are. And this sensation that we don't feel, but it's like a go without our conscious, it's received from proprioceptors, which are responsible for the place of our muscles joints to do coordinated movement. So here this question, okay, this one, a woman gave a birth to a child with toxoplasmosis. She believes that she has contracted toxoplasmosis from a friend who also recently gave birth to a sick child. What route of toxoplasmosis to a human is impossible? So toxoplasmosis is a parasitic disease, protozoa. It's transmitted from cats, okay, and it can affect. If it affects pregnant women, it can lead to child malformations and abortions. So how it can be transmitted? It can be transmitted by cats through contaminated water, contaminated food, so all of these. But what is impossible, it cannot be transmitted through it, is contact with a sick person. And this question came first time in medicine, this booklet, but it was present previously in dentistry booklets. I think 2020 it came for the first time. Yeah, 2020. So that's also, you should know about it. Okay, what else we have? Important questions. Okay, here anatomy question. The surgeon during surgery for inguinal hernia, the surgeon removes the superficial inguinal ring. It forms by the superficial inguinal ring. It forms by the aponeurosis of a certain muscle. What it is? So superficial inguinal ring, it's the opening or the hole through which the inguinal canal, okay, exits. So this is the inguinal canal. It starts from the deep inguinal ring, okay, and exits through the superficial inguinal ring. And what forms the superficial inguinal ring is the external oblique muscle. And we explain about this canal in details, its borders, inguinal hernia pathology in the course we make. Okay. What else? Also, this question may be a little bit, what must be added to donor blood preserved with sodium citrate to provoke its clotting? So first of all, when we take blood for donation, or we want to take blood and store it, we add to it citrate, because citrate prevent clotting of the donor's blood. Like if we take blood for like storage, we cannot just keep it like without adding to it anything. It will clot by itself. So we add to it citrate. And then if we want to like provoke its clotting, then we should add a clotting stimulator. And this clotting stimulator is calcium ions. Calcium ions like stimulate all participates in many reactions, coagulation cascade, and it can provoke clotting. Vitamin K needs some time to like provoke clotting, but calcium ions will be the better. Also, you can find all explanation of these questions in the PDF I will send on the Telegram channel. Okay, and the last one I would like to speak about, it's a very tricky question and not obvious at all. So, a man has a conjunctival rash, a rash on the skin of his abdomen and chest, okay? And then they told you that we have proliferative endothrombovasculitis in his brain, skin, kidneys, and myocardium. What disease is most likely in this man? So, first of all, a rash, then vasculitis or inflammation of blood vessels in the brain, skin, kidneys, and myocardium. So, you may think, first of all, systemic lupus erythematosus has rash, but they did not mention butterfly rash, which is like a specific pattern for systemic lupus. And systemic lupus does not cause vasculitis usually. Okay. Also, typhoid fever, it has rash on the abdomen, roseolar rash, but they did not mention anything about fever, diarrhea, symptoms. Also, typhoid fever does not cause vasculitis. Periarteritis does not cause rash, it's only vasculitis. So, why typhus? So typhus has this specific like conjunctival rash around the conjunctiva. Also, it has this proliferation in the vasculitis, not simply in the vasculitis. It's proliferative, like we have proliferation. And there was a similar question previous booklet, okay? And they mentioned the same thing, proliferative endothrombovasculitis, also skin, kidneys, and myocardium damage, okay? Also some spots like rash. And the answer was spotted fever, which is same as typhus caused by rickettsia. So you should be able to like pay attention while solving the questions, while practicing booklets, because some of them are really tricky, and maybe the same question they twisted in like a completely unpredictable way. So this was what I want to discuss with this booklet. If you have any questions about this booklet or anything else, you can contact me in Telegram. I will happy to answer your questions. And also don't forget to like and subscribe if you like these type of questions.